Cancer chemotherapy. Chemotherapy is the use of any drug, such as aspirin or penicillin, to treat any disease. But to most people, chemotherapy refers to drugs used for cancer treatment. Chemotherapy drugs is divided into several groups. These can be divided into several groups based on factors such as how they work, their chemical structure, and their relationship to another drug. Some drugs act in more than one way and may belong to more than one group. Knowing how the drug works is important in predicting side effects. These help doctors decide which drugs are likely to work well together. If more than one drug will be used, this information also helps them plan exactly when each of the drugs should be given. These are the alkylating agents, antimetabolites, anti-tumor antibiotics, anthracyclines, topoisomerase inhibitors, and mitotic inhibitors. Alkylating agents directly damage DNA, which is the genetic material in each cell, to keep the cell from reproducing. Because these drugs damage DNA, they can cause long-term damage to the bone marrow. Antimetabolites interfere with DNA and RNA growth by substituting for the normal building blocks of both RNA and the DNA. These agents damage cells during the S phase when the cell's chromosomes are being copied. They are commonly used to treat leukemias, cancers of the breast, ovary, and the intestinal tract, as well as the other types of cancers. Anti-tumor antibiotics. These drugs are not like the antibiotics used to treat infections. They work by altering the DNA inside cancer cells to keep them from growing and multiplying. Anthracyclines are anti-tumor antibiotics that interfere with enzymes involved in DNA replication. These drugs work in all phases of the cell cycle. They are widely used for a variety of cancers. Topoisomerase inhibitors. These drugs interfere with enzymes called topoisomerases, which help separate the strands of DNA so they can be copied during the S phase. Enzymes are proteins that cause chemical reactions in living cells. Mitotic inhibitors are often plant alkaloids and other compounds derived from natural products. They work by stopping mitosis in the M phase of the cell cycle, but can damage cells in all phases by keeping enzymes from making proteins needed for cell reproduction. Cytotoxic chemotherapy mechanisms of action. Cytotoxic chemotherapy refers to agents whose mechanisms of action cause cell death or prevent cell growth. Generally, they're inhibiting microtubule function, protein function, or DNA synthesis. Cytotoxic chemotherapy mechanisms of action may be cell cycle dependent, arresting cancer cell growth at specific phases in the cell cycle. However, chemotherapies such as alkylating agents act independently of the phases of the cell cycle. Specific nodes in the pathway that are therapeutically actionable are noted. What are the common side effects of chemotherapy? Different chemotherapy drugs have different short-term and long-term side effects. And certainly not all chemotherapy drugs cause every side effect. In general, chemotherapy damages cells that are dividing. So the parts of the body where normal cells divide frequently are likely to be affected by chemotherapy. The mouth, intestines, skin, hair, and bone marrow are commonly affected by chemotherapy. Although most anti-cancer drugs have side effects, not everyone will get these effects. A person may experience no side effects of chemotherapy, some side effects, or all of them. Whether or not a person will experience a particular side effect, when it will start and stop, or how bad it will be, depends on many factors. Some of these factors include how long a person has been taking the drug, a person's general health, the dose or amount of the drug, the way the drug is given, or other drugs that may be given in combination.